Hey, what's up, guys? I'm Chris, one of the pharmacists from eSmith Pharmacy. Welcome to our first online clinical training. Now, these training are all about boosting your clinical knowledge, helping you make the right clinical decisions, and giving you the tools to provide the best care for your patients. Now, they are suitable for all clinical staff, but we'll be focusing on nurses in the aged care setting today. So in today's training, we're going to dive deep into the management of recurring UTIs. And by the end of this training, you have a solid understanding of what recurring UTIs are, how to spot them, how to treat them, and what preventative options are available. So no time to waste, let's jump right in. Alright, let's start off by defining what recurring UTIs is. It's when someone gets 2 or more infections within 6 months, or 3 or more within a year. Now, UTIs are super common in older adults and can be a little bit tricky to handle sometimes. Typically, recurring UTIs are caused by new infections rather than a relapse of the previous infection that was treated with antibiotics. However, if a recurrence happens within a short time frame, likely less than 2 weeks after finishing the antibiotic course, it's more likely to be the same strain as the previous infection. Now, what do you do if you suspect one of your residents is suffering from recurring UTIs? Well, the problem with these infections is that they can lead to complications like sepsis, delirium, and increased morbidity and mortality. So it's crucial to manage them effectively. Now, there are 3 steps involved. Step 1 is to check for signs and symptoms of UTIs. The most common ones are dysuria, frequent urination, urgency, blood in urine, and pain in the lower abdomen. But keep in mind, elderly patients may have atypical symptoms like confusion, lethargy, or agitation. So it's important to be alert and rule out other possible causes of mental changes. Step 2 is all about emphasizing good hygiene practices to your nursing team and care staff. Prevention is still the key when it comes to managing recurring UTIs in the elderly. Teach them to wipe from front to back after using the bathroom, and encourage adequate fluid intake. And also remind them to avoid harsh soap that can irritate the urinary tract. The third step is about quick diagnosis and treatment when you suspect a recurring UTI. In general, a urine culture test should be done to identify the bacteria causing the problem, and also to guide antibiotic therapy. However, while waiting for the results to come back, it's important to suggest empiric antibiotic therapy with your facility doctor and start it promptly. Remember, we need to be mindful of antimicrobial resistance, which is becoming a serious concern. Prescribing antibiotics appropriately is crucial to prevent the emergence of superbugs that are resistant to multiple drugs. Hey, let's talk about some ways to prevent recurring UTIs. Prophylactic therapy is all about keeping those pesky infections at bay and making life easier for patients and yourself. Now, there are 2 types of prophylactic treatments, non-antibiotic and antibiotic. Now, besides good personal hygiene, there are some non-antibiotic options we can consider. However, it's worth mentioning that there isn't strong clinical evidence to support the effectiveness. One option is using topical vaginal estrogen, specifically the Ovastin cream. It's been shown to reduce the risk of UTI recurrence in postmenopausal women based on small-scale studies. And hey, the best part is, it is fully funded. The next up, we have cranberry products. Studies have shown that patients with a history of recurrent UTIs who take cranberry products have a 47% relative risk reduction for future infections compared to those who don't. But here's the catch. The dose of the active ingredient vary between products. Trial methods can be inconsistent, and dropout rates can mess things up. Plus, too much cranberry can upset your stomach and send your sugar intake skyrocketing. So if you're recommending cranberry products, aim for the high percentage formulation, anything about 80% for better effectiveness. Now let's talk about probiotics with lactobacillus. Now these little guys have shown promising results in preventing UTIs. Unfortunately, oral formulation hasn't shown clear efficacy in clinical trials. However, there was a small trial where intravaginal probiotic suppositories containing lactobacillus decreases recurrent UTIs by 12% compared to the placebo. Now, the downside is that this suppository aren't readily available in New Zealand, so that's a bummer. Now, some of you may ask me, what is the role of D-mannose as a non-antibiotic therapy in the management of recurrent UTIs? Now, D-mannose is a natural sugar found in fruits like cranberries, peaches, and apples. People getting excited about using D-mannose for UTIs, especially for those who keep getting them. Now, the idea is that D-mannose can prevent bacteria from sticking to the urinary tract walls and reduce the risk of infection. See, the bacteria like E. coli have those tiny little hair-like projections called fimbriae that binds to receptors on the urinary tract. And D-mannose can mimic those receptors, so the bacteria binds to it instead and get flushed out when you pee. Several studies have shown that D-mannose can be effective in reducing the risk of recurrent UTIs. One study even found it to be as good as the antibiotics nitrofurantoin in preventing UTIs over a 6-month period. Another study showing that women taking D-mannose had a significant lower risk of recurrent UTIs compared to those who didn't. Now, D-mannose is generally safe and doesn't have many reported side effects. However, it is not a replacement for antibiotics when you are dealing with an active infection, because it won't kill the bacteria causing trouble. So there you have it, guys. Some options for prophylactic therapy to tackle recurrent UTIs. Alright, let's dive into the gold standard of managing recurrent UTIs. When personal hygiene isn't cutting it, low-dose antibiotics are the way to go to prevent those pesky infections from coming back. Now here's the deal. Women with recurrent UTIs are more than 6 times less likely to get another one if they take prophylactic antibiotics. But hold up, we gotta balance the benefit with the risk of antimicrobial resistance. Now, antibiotic resistance is a serious issue and we don't want to create superbugs. So keep in mind that this approach isn't suitable for everyone, and good personal hygiene is still the frontline strategy for preventing recurrent UTIs. Now let's talk about the antibiotic options for prophylactic therapy. The main contenders are nitrofurantoin, usually a once daily doses of 50 mg to 100 mg at night, or trimethoprim 150 mg at night, or cefalexin between 125 mg to 250 mg once a day. So the next question is, how long should prophylactic antibiotics be prescribed for? Well, the optimum duration isn't crystal clear. However, if they have been prescribed, the doctor should review the effectiveness and the risk of continued use within 3 to 6 months. Alright guys, let's shift our focus to the antibiotic nitrofurantoin. As one of the go-to antibiotics for prophylaxis against recurrent UTIs, nitrofurantoin is a real powerhouse that messes with bacterial cell walls and disrupts the DNA synthesis. It's effective against the most common culprits like E. coli and Klebsiella pneumoniae. Studies have shown that nitrofurantoin gets the job done in preventing recurrent UTIs, especially in postmenopausal women who are more prone to those pesky infections. It even outperformed trimethoprim in one study for elderly women with a history of recurrent UTIs. Nitrofurantoin is a preferred choice because it has low resistance rates and minimal impact on the gut bacteria flora. And that's important because we don't want to create antibiotic-resistant organisms, and disrupt the gut flora can lead to Clostridium difficile infection. However, nitrofurantoin isn't for everyone. It's a no-go for patients with kidney problems since it eliminates primarily through the kidneys. And if someone has a chronic lung disease, it could cause some pulmonary toxicity. We also need to be cautious with patients who have glucose 6-phosphate dehydrogenase deficiency because it can cause hemolysis. Alright guys, let's talk about Heparix, the not so traditional antibiotic that fights recurrent UTIs. Heparix, also known as methionine heparate, is our alternative form of antimicrobial prophylaxis for patients who have had a fair share of UTIs and wanted to avoid those never-ending courses of antibiotics. Now here's the deal with Heparix. It's got some bacteriostatic powers, but it's not your typical antibiotic. Its effect is non-specific and here's how it works as magic. First, it creates an acidic party zone in your urine, making it a real challenge for those bacteria to grow and survive. But that's not all. Heparin is like a secret agent in disguise. It's made up of methylamine hyprate, which, when it breaks down in urine, releases formaldehyde. And guess what? Formaldehyde is one heck of an antimicrobial agent. It's like the ultimate enemy of the UTI-causing bacteria, including the notorious E. coli, Proteus, Klebsiella, and Enterobacter species. Now, clinical studies have shown that Heparin is the real deal when it comes to preventing recurrent UTIs. It's got a success rate of around 17 to 90%. However, the catch is that Heparin is not a one-time thing. It's a long-term commitment. You got to take it continuously for several months to make sure those UTIs don't come back knocking on your door. Now, here's the lowdown on safety. Heparin is generally considered safe and well tolerated. However, some people might experience a bit of gastrointestinal upset, nausea, or even skin rash, but nothing too serious though. Also, if one of your residents have got severe kidney disease, Heparin might not be the go-to option because formaldehyde can accumulate in your body and cause some serious toxicity. So there you have it, guys. Heparin, the not-so-average antibiotic warrior, fighting recurrent UTIs and keeping you in the clear. It's like having a trusty sidekick on your urinary tract adventures. Alright guys, let's wrap this up and get down to the nitty-gritty of managing recurrent UTIs in the elderly. Trust me, it can be a real challenge, but we've got some tricks up our sleeves. First things first, prevention is key. We need to emphasize good hygiene practices like there's no tomorrow. And when it comes to diagnosis and treatment, we gotta be on the ball, quick as lightning. Time is of essence here. But hold up, we can't forget about finding underlying causes. There might be something sneaky lurking beneath the surface, and we need to uncover it. Once we've got that sorted, it's time to consider non-antibiotic or antibiotic prophylactic therapy. But here's the deal, guys. Prolonged antibiotic use is not always appropriate. We need to balance the benefit with the risk. We don't want those pesky bacteria developing resistance. Plus, we got to watch out for any nasty side effects. We want our patient to feel better, not worse. So how long should we keep up with prophylactic therapy? Well, that's a very good question. And that's where personalization comes into play. We got to tailor it to each patient based on the individual risk factors and how they respond to treatment. One size doesn't fit all in this game, unfortunately. Now listen up, guys. You are the real MVPs here. Your role is crucial. You need to be the master of education, spreading the word to your clinical team, care staff, and the patients themselves. It's all about hammering home the importance of good hygiene, making sure everyone gets the right diagnosis and treatment, and keeping an eye out for any unwanted effects from those antimicrobial therapies. Alright guys, thanks for tuning in. Please subscribe, like this video, and press the notification button so that you'll get notified of any new videos from me. And I'll see you next time.